This video, we are going to see the various sequences that you will see commonly with an example of the MRI, liver and biliary protocol. So T1 in phase and out of phase, T2 fat saturated, T1 fat sat or pre-contrast. Then you have the images of arterial, venous, delayed and parenchymal phases. And then you have MRCP if you have requested. Those are heavily T2 weighted images. So you'll understand what all these terms mean and how you can identify them, trying to just simplify the concept so that you can identify the images and then learn how the various pathologies will look in these images if you understand the basics of water and fat and the ionic hydrogen in there. So in the previous part of this series, we have already seen that magnetic resonance imaging, the magnet provides the proton alignment along the z-axis and the precessing of the ionic hydrogen protons, which is also known as at Larmor frequency. When we give a radio frequency pulse perpendicular to the z-axis, we are doing something to excite the protons by giving the pulse matching the Larmor frequency, that is known as resonance. When the pulse stops, the protons are going to go back to their resting state, but because they are in the magnet, they will stay aligned along the z-axis. And while they are returning to this phase, they will emit energy so as to come back to their baseline energy status. This emittance of energy is basically taken by the receiver in the RF coil, and that is what is going to give you the time as well as the signal, and that is converted into an image by the computer. So the input is the RF pulse, the output is the current that is taken by the coil and converted into an image. So now we are going to see the images, and this next 2-3 slides are just to understand how the image is generated, what is T1 and T2. So that is something that you understand. So the graph is showing X, Y, and Z axis. We know that the Z axis is along the direction where the current is given. The arrow points in the direction of the current. Now, when you give an RF pulse, what happens is that the current is in the perpendicular direction to Z axis. That is the XY plane. So the ionic hydrogen, the direction of its net magnetization vector is also in the XY plane. Now, when we stop the pulse, what happens is that after some time, the different ionic hydrogens will reach their resting state at different times. Okay. And what has been understood is that water takes a very long time to return back, whereas fat takes less time to return back. And this is the basic concept of doing an MRI. Okay. So the water molecules will still dephase in the XY plane because the RF pulse has stopped. The protons are now not aligned. Basically, something like when the period is over in a school, the children again start creating chaos. But it is at the end of the school when they will leave the classroom and go home, right? Similarly, when the RF pulse stops, initially the net magnetization vector gets dephased because the protons start losing the energy at different rates, even in the XY plane. And this is known as dephasing of the ionic hydrogen. Now, how you can measure the dephasing is the time that it takes to dephase. So basically the amplitude of the movement keeps decreasing, and that is known as T2 decay. So if you see here, what you do is you take it back to the x-axis from wherever it is moving in the xy plane. You take it down, and this length is basically the length that we measure. So the time that the protons take from the signal to drop to 37% of its initial value is the T2 relaxation time. So basically, when the pulse stops, the multiple ionic hydrogens stop being in alignment. The first alignment that they will break is in the XY plane because they were in the XY plane in direction of the RF pulse. So the breaking of that alignment is known as dephasing, and this keeps reducing with time, right? It will decay over time. It's like an echo. When you say something, there is an echo, then the voice keeps slowing down, right? Similarly, the pace of the atoms keeps slowing down, and when it becomes 37% of the original value, so somewhere here, when it reaches, that is taken as the T2 relaxation time. Like I said, water takes a long time to relax, so the signal of water will be there for a longer time, and that is why water is bright on T2. Okay. On the other hand, fat takes less time to reach the 37% mark and then starts going towards the resting state, that is the z-axis, and that is why fat has a shorter T2 relaxation time. So when we say T2 phase, we are basically talking of the dephasing of the protons in the XY plane. Now, there is a concept called spin-echo sequence where what you do is you give another 180-degree pulse right when these things are dephasing. So you give one more 180-degree pulse, and what that will cause is that will again align them in the XY plane and increase the signal in T2. Okay, so spin-echo is basically going to make T2 more bright, right? So that is the concept of giving two RF pulses, or also known as spin-echo sequence. If you're not getting this, it's okay, but something to understand that the alignment breaks first in the XY plane, and when it breaks so much that the only 37% of the signal is left, that is known as T2 relaxation time. Now, like I said, once the RF pulse stops, the ionic protons and the net magnetization vector, that is the collective magnetic field which is in direction to the z-axis, as it had become along the xy axis, it will again come towards the z-axis, right? Now, the T1 time is the specific duration required for the proton's net magnetization vector to recover to about 63% of its original strength. So to reach 37% of XY plane was T2, 100 minus 37 is 63. So when it reaches 63% of its original strength towards the Z, so if you project this towards the Z, and if this is 63%, this is T1 relaxation. Now, when we stop the RF pulse, we know that fat is a poor, fat converts faster. So fat T1 times are longer because it reaches 63% faster. Whereas water takes a longer time, so water is not going to have a good T1 phase. So water is black on T1, whereas fat is white. So looking at T1 weighted and T2 weighted, like I said, water is black on T1 because it takes a very long time to reach 63%. The signal is very weak compared to T2, where the water is bright because it has a long T2 relaxation time. Fat is bright on T1 as the signal is stronger in T1 compared to T2, where the fat is still grayish in color unless it is a fat saturated image. What we mean by that is we are trying to minus the fat from a T2 image to make water more brighter. Okay, basically we are contrasting. Okay, so this is a matter of contrast between black and white. So if you reduce the signal of fat, you can make water more whiter, right? So heavily T2 weighted images or fat saturated images. So either multiply the water's T2 or you subtract fat's T2. That is how you can make T2 more heavy. So fat saturated T2 images will not show fat as white, it will show fat as black. Now, blood differs whether it's acute and chronic, but usually subacute blood is nearly gray in T1 weighted images. It is hyperintense in T2 if it's early, and it is hypo if it's late. Hemosiderin and fibrosis are usually black in T1 and T2. So just to summarize the different elements, you need to remember this when you are going to see scans. Remember that bone is black in both T1 and T2 because calcium and cortical bones are black air is black in T1 as well as T2. So that is common to all. White fat is white. Gadolinium is a contrast that is used in MRI, that is white in T1. So contrast phases are T1. Okay. Another MCQ. Gray is intermediate high protein tissue such as abscess, okay, pus, cyst, gray matter. High protein tissues are gray. Gray matter is gray, okay, in T1. And darker is fluid, ligaments, tendon, abdominal organs, and cartilage. When it comes to T2, like I said, air, calcium, cortical bone are still black. Ligaments, tendon, abdominal organs are still dark, but free fluid and water is white. So that is a T2 image. So if you can see these images, the first image is how to identify, look at the ventricles. They are black. So this can be a T1 image. Compare the ventricles here. The water is very bright. This is a T2 image. Gray matter is looking gray. So that is also something that is good. Now here, if you see, the gray matter is more darker, the water is also not white, and still you can see some areas around the ventricles which are showing very good contrast, which you cannot appreciate here or here. So there is something white here, but the gray matter is not as gray and the water is not as white. This is a fluid attenuated sequence of T2. So this is a fluid attenuated sequence, just like I said, fat saturated sequence, where fat is saturated in T2. Here, fluid is saturated or fluid is attenuated in T2. And what you are trying to gather is small lesions at the margins of the ventricles. Okay. So these are the structures that will be seen better in a FLAIR image. So this is a FLAIR image. Okay. Now, like I said, to increase the contrast of water, it is a heavily T2 weighted image, that is MRCP. Remember that MRCP has no injectable contrast. The water or the ionic hydrogen in the bile access contrast. These are heavily T2 weighted image. So you subtract all the organs that are surrounding, which will have signals on T1, and their T2 signal are negated by making the sequence heavily T2 weighted. Okay, this is a T2 or T1. If you want to guess, the easiest thing is look at the spinal canal. If the water is white, it is T2. Here, the water is not white. So this is a T1 image. Is there contrast in aorta? No. Is there contrast in portal vein? No. So this is a T1 non-contrast image. Okay. Is it fat saturated or not? You can see the subcutaneous fat, that is very nicely seen. So this is not a fat saturated image. Do you see artifact, that is the enhancement of the borders of the organs, which is known as an India ink artifact, that is seen in an opposed phase image. Okay, so fat saturated and opposed phase more or less similar. So this is basically a simple T1 phase of MRI. Okay. What you do in pulse sequence is like a choreography of pulses and gradients. So temporal pattern and shape of the pulse and the gradient are used to obtain image, and this is known as a pulse sequence. So just like our pulse comes and goes, comes and goes, comes and goes, similarly the radio frequency pulse is timed in a way that you get specific features of MRI. Spin echo imaging, when the blood is black, basically flowing blood becomes black in spin echo, whereas there is high signal in the surrounding stationary tissue, basically used to study the parenchyma. Like I said, spin echo sequences use a 180-degree refocusing radio frequency pulse immediately after the first pulse, and this allows for a true T2 weighted image. On the other hand, when you are doing a gradient echo imaging, such as MR angiography, you want to highlight the flowing blood. What you do is you change the gradient by using a large flip angle. This increases the T1 contrast. However, remember that both gradient echo and spin echo sequences can be manipulated to create T1 or T2 weighted images. So that is something to remember. Why is this important? Because whenever you are going to study imaging, Gradient echo images are important, especially in liver protocol. In phase and out of phase is basically studied to identify fat. Okay, so in T1, okay, we know that fat is brighter. So in phase means that the time when water and fat protons are aligned to each other. So before fat starts moving out of the XY plane is in phase. Okay, both of them are in one direction. Both of them are together. That is in phase. So here you have a bright signal of the fat tissue added by signal of water as well. So fat looks very bright. Out of phase image, if you take a gradient echo image which is out of phase, what that means is that the protons that are at 180 degree from each other, basically water and fat, cancel each other out. So the fat loses signal in the areas which contain fat as well as water. Okay. So in out of phase image, the bright fat that is seen in the in phase looks darker. So when you compare in phase and out of phase, radiologists can identify a signal loss which indicates that that area contains fat. Okay. So the concepts that we saw, what is in phase, what is out of phase, what is D phase, in phase is when everything is causing the net magnetization vector. When the pulse stops, the fat starts moving faster towards the Z, they become out of phase. The parts of protons which are at 180 degree for water and fat cancel each other out. That is known as out of phase. So fat loses signal. Now, how to identify this in MRI is the last point that we are going to see in a liver protocol MRI. So just watch out for that slide where you are going to have around 8 images. And I'm sure that now you can identify what we are seeing when you are seeing an MRI. So T1 weighted MRI, we know that fat has a bright signal. In fat suppressed MRI, it will have a dark signal. So this is something that you can do by using fat suppressed MRI. So now fat saturated or fat suppressed is also cancelling out fat. Opposed phase is also cancelling out fat. How can you differentiate them? Understand that the opposed phase needs both water and fat. It is a microscopic event. It does not affect macroscopic fat. So wherever there is microscopic fat like fatty liver, that fat gets negated, but subcutaneous fat where you have macroscopic fat globules, that is not affected by opposed phase MRI. Another way to identify is the India ink artifact, that is a sharp black rim around the fat that is seen in opposed phase MRI, that is not seen in T1 fat saturated MRI. Remember that the pre-contrast image is a T1 fat saturated image because it can bring out the contrast better. Okay, so that is something that you need to remember. So now coming to the most important slide of our presentation, and this is where we started that we want to identify all these scans. So now if you see, let us see how you can label them. I have not given labels to any of them. So we will wait 30 seconds or you can pause the video here and you can try to identify at least some of these images. If you have seen the liver MRI video and other MRI videos that we have put, I am sure you can identify at least 4 or 5 of these. If you cannot, we are going to discuss them in about 10 seconds from now. So you can just wait and watch how we identify the sequences. Okay. So first thing you see, like I always say in the abdomen, is look at the spinal canal. If the spinal canal is black, these are T1 images. Okay. So if the spinal canal is black, they are T1 images. The only image where spinal canal is white is here. This is a T2 weighted image. Other thing you can see is lumen. You can see the gastric lumen. You can see this lesion is filled with water. You can see something here that is filled with water. All these things are white. This is a T2 image. Okay. Now, if you see this image and compare this fat versus this fat, you will see that the fat is not as good seen. The fat is not as well seen as in the T1. Okay. So a T2 fat saturated image is something that you will use where the water is very bright and the water in lesion can be brought out. Okay. Now coming to, so this is T2, all others are T1. That is the first point. Okay. Now, when you see these two images, you can make out that there is a sharp outline. You can see here this black outline. There is a sharp outline that is there in this image, which is not there in this image. Okay. The other thing you can see is the liver looks different in these two. Okay, you can see that the liver looks different in these two. What is happening is this is an in phase image and this is an out of phase image. Okay, so this outline is known as India ink artifact, and this pinpoints a diagnosis that you can see around kidney, the fat leaves an outline in the opposed phase. So this is an opposed phase image. This is an in phase image. You can see the difference in the liver. So probably a bit of fatty liver is there. Then going into the next T1 here, you can see the fat here, subcutaneous fat can't be seen in any of these. So these are T1 fat saturated images, okay? You can't see the India ink artifact in any of these. That is because this is a fat saturated image. This is a opposed phase image, right? So C is T2, all other are T1. This is in phase, this is out of phase. This is the pre-contrast fat saturated image, okay? So this is a T1 fat saturated pre-contrast image, okay? Then you can see contrast in the aorta, right? This is the aorta. You can see contrast. So this is the arterial phase. You can see contrast in the portal vein and filling in of the lesion peripherally. Portal phase, parenchymal phase, you can see the lesion still keeps filling up. You can see the lesion still keeps filling up. Most probably a hemangioma, right? And this is the delayed phase where you can see the washout. Okay. So this is how you can identify. So now with this series and 20-30 minutes of what we have discussed across two videos, you can at least identify these 8 slices of MRI. If you practice more, you will learn to identify lesions. You will learn to identify concepts of MRI. Look at the fat. If you can't see the fat, it's a fat saturated image. Usual trick is if it's a contrast MRI, the slide before contrast MRI is a pre-contrast image, which is a T1 fat set image. Okay. T2 is where the spinal fluid is white, or any place of fluid like in brain, the ventricles are white. That is how you can remember it is T2. So T2, T1 fat set, arterial, portal venous, parenchymal or delayed. Okay, that is how you can identify the phases in MRI. So I hope that with series of this videos as well as the MRCP video that we already have, we have a video on MRI rectum by Dr. Amar, who's a radiologist. So all these videos of MRI, when you see together, you will come to learn how to see MRI, how to identify pathologies. We are also going to come up with a MR fistulogram, so that is something to look forward to. And with all these MRI, some cases of MRI, maybe liver, you can see in the upcoming series, and that is how you will learn how to identify pathologies and the various series in MRI. Thank you.